Good evening and thanks very much for joining us. I'm Brittany Ramsey. Controversial anti-masker Chris Sky brought his anti-lockdown brigade through Thunder Bay last night, which ended with him being arrested by Thunder Bay police. Sky was a no-show at the planned Waverly Park rally, but he did speak at Hillcrest Park and was then later detained by police. Troy Charles has details.
After speaking to a crowd of 100 supporters at Hillcrest Park, the vehicle that Chris Sky arrived in was pulled over by police a few blocks away. Sky didn't appear to be in the vehicle when it was pulled over. However, a short while later, police did arrest him and he recorded himself at the police station. In a statement, police say the organized gathering was in violation of the province's current stay-at-home order. They arrested the 37-year-old Sky from King City, Ontario, and charged him with breach of undertaking, as well charging him under the Emergency Management and Civil Protection Act. He was arrested and released with a future court date. Earlier in the evening, around 200 people gathered in Waverly Park, hoping to witness Sky's cross-country anti-lockdown protest. He did not show up there, but others spoke to the crowd.
And says, we're not going to take it anymore!
At several points during the rally, groups of counter-protesters in their cars attempted to drown out the rally by honking and playing loud music. There was a small police presence at the rally, but they watched from afar. After an hour of waiting for Sky to show up, people were told to walk up to Hillcrest Park. That's where Sky briefly spoke to his supporters, telling the crowd he was ordered not to speak to them.
Don't be afraid to lose your job either. Yes, and do not be afraid to lose your job. What's more important, your job or your life? Oh, there go the police. So I'm going to have to come down here and be like, guys.
Two other event organizers, one person from Thunder Bay and one person from British Columbia, were also charged under the province's Emergency Management and Civil Protection Act. This afternoon, the district's medical officer of health was asked for her thoughts on the anti-lockdown rally.
You know, COVID has cost us a lot here. And when we look at what we've been through and when we look at the risk to acute care settings like the hospital and what they went through recently, I think it's like a slap in the face that they do that, quite frankly, as a public health professional. But I do realize that people have their opinions and they're allowed to have their opinions.
Troy Charles, TBT News.
New COVID cases in the Thunder Bay district remain in single digits today. The health unit is reporting 5 new infections. 3 come from the Thunder Bay area and 2 are from elsewhere in the district. 4 are due to close contact and 1 is related to travel outside northwestern Ontario. The total case count now sits at 3,081. 61 are still active, which is 5 less than on Tuesday. Meanwhile, those looking to get a COVID vaccine will see fewer appointments available over the next while. Thunder Bay's medical officer is expecting shipments to slow down slightly, but should ramp up again in May. Dr. Janet DeMille is also concerned of more variants being identified in recent weeks. Corey Nordstrom has details.
The supply of COVID-19 vaccines going forward is uncertain for all but one of the vaccines used locally, according to Medical Officer of Health Dr. Janet DeMille. She is optimistic about Pfizer availability the second half of May, where weekly shipments of the vaccine are expected. But before that, less will be diverted to Thunder Bay.
I do anticipate that our numbers for immunization next week might drop a little bit just because of some of the supply, just a lower supply overall. But we hope to see over the month of May that the vaccine supply will increase.
The health unit has noticed a recent rise in variant cases. Of the 25 reported to date, 21 of those came in the last 2 weeks, and 10 of them are associated with the Musselwhite Mine outbreak.
It is a concern, given what's happening in other parts of the province and other parts of the country, that more variants can be introduced here. And we do know that one situation or one outbreak can lead can set us off in the wrong direction again. So just I'm very mindful of that.
The variants of concern are known to be deadlier and spread easier than the original COVID-19 virus. And while the Thunder Bay district seems to be heading in the right direction as far as active cases, those variants could reverse the trend.
That is a significant uncertainty, but at the same time, we have a lot of public health measures in place. And we also see some decline in cases in other areas. So hopefully that will reduce the chances of people coming here with the variants.
The medical officer of health believes the lockdown measures are working both locally and across the province to keep case numbers down. But as far as the possibility of area schools reopening next week, DeMille says she hasn't heard any news from the province yet on that front.
I would like to see schools reopen for in-person learning at some point before the end of the year.
Corey Nordstrom, TBT News.
Meanwhile, Thunder Bay residents could be waiting a while if they're hoping to receive the AstraZeneca vaccine. It appears that most, if not all 4 local pharmacies carrying the vaccine have run out, and there are no timelines on when those locations will get more. Officials at Oak Pharmacy on Arthur Street used up the last of their vaccine doses today, and Vinay Kapoor with Dawson Heights Pharmacy says supply ran out last Thursday. They're hopeful to receive more, but he's not overly optimistic given the growing need of vaccines in the province's hotspots.
Doses have been reallocated to hotspots in southern Ontario, and since we've run out, the phones have been ringing off the hook as well. So there is quite a bit of demand for them. As doses roll into the store, we'll open up appointment slots, or if people cancel. So as the time goes by, just keep on visiting the website.
Kapoor admits while it's frustrating to have no vaccines to give right now, he is glad they're being used in places that really need them instead of sitting in a warehouse unused. Thunder Bay Regional received its first COVID-19 intensive care patient from Southern Ontario today. The hospital continues to work with the province as a system partner to manage the rising case numbers in the GTA. Dr. Peter Voros, the regional's COVID-19 incident manager, says one more patient is currently scheduled for transfer to Thunder Bay this week, but it's not clear what might happen beyond that. The province's COVID-19 critical care command table has ordered the hospital to expand its ICU capacity to 30 beds, which is 4 more than they're working with now. However, only 18 are currently occupied.
It really is a picture where we need to recognize that, as one province, we work as one system and we all support each other and work together the best that we can. They came to our aid in March when we needed to move some patients. Now it's really our turn to help out what's going on in Southern Ontario, and we will do so in any way that we can. And staff are on board to reallocate and go and help these expanded areas function.
Ontario is giving its hospitals power to transfer patients to long-term care homes without their consent. The move is aimed at keeping hospital beds available for COVID patients and will only be done when the need is urgent. Colin DeMello reports.
The pressure of the third wave on Ontario hospitals isn't subsiding, and Ontario is in desperate need of hospital beds. Today, the government is taking the rare step of allowing hospitals to move chronically ill patients into a long-term care home.
This temporary emergency order will provide hospitals with the flexibility to transfer certain patients, those whose doctors have determined no longer require hospital care and could be better supported in a more appropriate setting, to a long-term care or retirement home.
The government says doctors will assess the situation and consult with the patient before deciding if and where to move the patient. The measure would only be implemented in hospitals that are dealing with a COVID-19 surge and could be carried out without the patient's consent. The province has already tried to free up thousands of hospital beds by canceling non-emergency surgeries, but is still facing a crunch with 877 people in ICU as of today. But Ontario Health is projecting a sliver of positive news about the state of the pandemic and its impact on hospitals.
There's some encouragement. The case numbers do appear to be flattening. There's a bit of a lag. We have to see the case counts come down first. And then we will see the impact in the ICUs and in hospitalization. And that time lag can be about 2 to 3 weeks. So we really need to get that case count down.
But the government is facing accusations of worsening the situation by not bringing in paid sick leave.
When will this government stop the nonsense and put in place a paid sick day program in the province of Ontario to save the lives of working people?
I know Minister McNaughton is continuing his conversations with the federal government because we all want people in Ontario, in this case, to be able to take sick leave if they need it.
We could see a significant update today on the paid sick leave issue. The Minister of Labour as well as the Minister of Finance are both expected to hold a news conference on that issue today at 3:15 in the afternoon. Colin DeMello, CTV News.
Meanwhile, locally, Dr. Peter Voros at Thunder Bay Regional said he doesn't expect the hospital to be significantly impacted by that move from the government to allow hospitals to transfer patients to long-term care homes without their consent. And we know senior citizens were the hardest hit by the pandemic in the early months. Now, Ontario's Auditor General has released a scathing report into the province's response to COVID-19 in long-term care homes, saying there was little preparation at the onset of the pandemic. The report also identifies other problem areas contributing to COVID-19's deadly spread, including crowded living conditions with 3 or 4 people to a room and poor infection prevention and control. Lisk was asked if she believes those issues led to more deaths.
The crowding issue is one that experts have commented that had that not been the case, there might have been less of a mortality rate in the long-term care sector. So in that respect, that might have been one. We've heard when we followed on the commission's hearings, I mean, people did testify that, residents did pass from other issues other than COVID, malnutrition. And, part of that does make you wonder if more hands there would have made a difference.
Lisk says the chief lesson of the SARS outbreak that wasn't applied here by the government was making decisions in a timely manner. Now, more details on paid sick leave for Ontario workers. Following intense pressure from the opposition at Queen's Park, the Ford government is finally offering more sick leave support for Ontario workers. The province says it will begin providing up to $200 a day for 3 days to reimburse employers when staff are forced to take time off for COVID symptoms. Labour Minister Monty McNaughton made that announcement this afternoon.
Our government will also lead the way by introducing the COVID-19 Putting Workers First Act. Through this bill, we are the only province in Canada to introduce paid sick days specific to COVID-19. If passed, all workers will soon have access to 3 paid sick days. This is more than the 1 day available to workers in Prince Edward Island and the 2 days available to workers in Quebec. This is a game changer, and this will save lives.
The new measure is designed to supplement sick time provisions offered by the federal government. The Northwestern Ontario Municipal Association kicked off its 3-day annual general meeting today virtually. It's NOMA's first AGM since 2019 due to the pandemic. The event began with statements from opposition leader Andrea Horwath and Ontario Liberal leader Stephen Del Duca. They were supposed to follow remarks from Premier Doug Ford, but he's now been rescheduled for day 3 on Friday. Presentations then followed from the Association of Municipalities of Ontario, the Nuclear Waste Management Organization, and others. Hydro One representative Jason Fitzsimmons then took questions from NOMA President Wendy Landry, who asked about rising rates for some in our region.
Is there a reason why the seasonal rate for cottagers has increased so much this year?
Hydro One was quite vocal about our opposition to this change, which was to eliminate the seasonal rate class, which had existed for many decades. But eventually there was a decision that class would be eliminated, and just like a court decision, we may not like the decision, but at the end of the day, we have to respect that in a democratic system.
Fitzsimmons also notes that 70% of charges are a result of regulatory costs that are outside of Hydro One's control. The NOMA conference continues tomorrow morning. On the eve of a special council meeting to discuss next steps of the stalled indoor turf facility, Mayor Bill Morrow says he will not try to set aside any of Thunder Bay's 2021 federal gas tax for the controversial project like he did back in 2019. Ottawa has doubled Thunder Bay's gas tax allocation this year, injecting an additional $6.6 million into the city coffers. A similar bump was offered in 2019 as well. In December of that year, City Council passed a resolution from the mayor allocating that additional money to the turf facility. At the time, Council was moving full speed ahead on the project, but it's since hit a major roadblock after councillors voted not to award the construction contract due largely to the rising cost of the work. Morrow says now isn't the time to steer any additional funds to the facility.
Clearly, we are in a position where council has said no to the award of the tender. We clearly need to decide what will be the next steps, if any, before any decisions are made. So I'll be interested in the discussion on Thursday night to see what, if any, direction comes out of that.
Tomorrow night's virtual turf facility meeting starts at 5:30. No formal decisions will be made at that time. Members of the public can watch the meeting on the city website or Shaw TV, and we'll have a full report on tomorrow's late edition. A virtual sit-down was hosted today between the owners of the Lac des Îles Palladium Mine and the Community Economic Development Commission. Officials with Impala Canada say there's an increasing need for skilled workers in the mining field. The CEDC is projecting up to 3,600 new mining jobs in the region in 3 years' time. The mine, located an hour north of Thunder Bay, currently has partnerships with 300 local businesses. And Impala CEO Tim Hill says it's a priority to expand the work they do with area vendors. In the Q&A portion, the CEDC's Eric Sikorski sought out an outline for the future.
Taking into account the rise in commodity prices, how successful are you or your team in terms of adding resource numbers from current drilling and exploration? Can you speak a little bit about sort of the, I'm not asking you a forward-looking statement, but can you speak a little bit about the future?
So we're investing in exploration to increase the life of mine and the discovery of additional resources, and we're seeing success with this, as I said. But we're also investing in infrastructure that can impact the life of mine through increased efficiencies and reducing costs, making lower grade resources economically viable.
Hill also hopes the company can increase the 12% of workers that are Indigenous.
All right, Fee, 15 degrees is not exactly beach weather, but compared